The most important causes of infectious diseases are bacteria, fungi, virus, and other parasites, which result in death, disability, social and economic disruption of millions of people around the world. Despite safe and effective interventions, there are people who lack access to the basic necessary resources, basic necessary preventions, methods, and treatments. Mostly, the developing countries are the biggest sufferers of infectious diseases. Here, co-infection is a very common phenomenon. The adverse effects of infectious diseases are found mainly in village communities, where they have no or very limited access to the basic healthcare resources.
Infection, as everybody knows, it is the entry of some microorganism into the body of human being, maybe any animal or any organism. But however, we shall speak here about human beings. Infection is the entry of any microorganism into a human being's body, and the disease, dis-ease, that does mean whenever this causes disturbance in the ease of the person, that means the person starts producing symptoms. This is disease. So, infectious diseases are because of the infection through the microorganisms, and microorganisms do not directly come to be in contact with the body, but there are certain modes of transmission. We know air is the best mode of transmission for various microorganisms. The second mode of transmission may be water. The third mode of transmission may be vectors. It may be mosquitoes, it may be something else, some other insects. Similarly, we have mechanical transmission and other transmissions.
Approximately 14 to 16 million people die every year due to infectious diseases, out of which children are most vulnerable. Pneumonia, diarrhea, and malaria are the main causes of death amongst the children below the age group of 5 years. Cerebral malaria can cause permanent mental damage. Even the adults get affected due to infectious diseases. Mental disability, reduced quality of life, decreased productivity, and even death.
Food or waterborne diseases acquired through eating or drinking. Hepatitis E. Waterborne viral disease that interferes with the functioning of the liver. This disease is most commonly spread through fecal contamination of drinking water, and victims exhibit jaundice, fatigue, abdominal pain, and dark-colored urine. Typhoid fever. Bacterial disease spread through contact with food or water contaminated by fecal matter or sewage. Victims in this case exhibit sustained high fever. Malaria. This is caused by single-cell parasitic protozoa Plasmodium. It is transmitted to humans via the bite of the female Anopheles mosquito. The parasites multiply in the liver, attacking red blood cells and resulting in cycles of fever, chills, and sweats accompanied by anemia. If not treated properly and in time, it may lead to death due to damage to vital organs and interruption of blood supply to the brain. Yellow fever. This is a mosquito-borne viral disease. Its severity ranges from influenza-like symptoms to severe hepatitis and hemorrhagic fever. However, it generally occurs only in sub-Saharan Africa and tropical South America, where most cases are reported. Japanese encephalitis. This is a mosquito-borne viral disease associated with rural areas in Asia. Acute encephalitis can progress to paralysis, coma, and death. Plague. It is a bacterial disease transmitted by fleas normally associated with rats. Person-to-person airborne transmission is also possible. Recent plague epidemics which occurred in Asia, Africa and South America were associated with rural areas or small towns and villages. The disease manifests itself as fever, headache and painfully swollen lymph nodes. It progresses rapidly and without antibiotic treatment leads to pneumonic form with a death rate exceeding 50%. Rift Valley fever. This is a viral disease affecting domesticated animals and humans. Transmission is by mosquito and other biting insects. Infection may also occur through handling of infected meat or contact with blood. Chikungunya. It is a mosquito-borne Aedes aegypti viral disease associated with urban environment and is similar to dengue fever. It is characterized by a sudden onset of fever, rash and severe joint pain, usually lasting 3 to 7 days. Water-contacted diseases acquired through swimming or wading in freshwater lakes, streams and rivers. Leptospirosis. This is a bacterial disease that affects animals and humans. Infection occurs through contact with water, food or soil contaminated by animal urine. Symptoms include high fever, severe headache, vomiting, jaundice and diarrhea. This disease is caused by parasitic trematode flatworm, Schistosoma. Freshwater snails act as intermediate host and release larval form of parasite that penetrates the skin of people exposed to contaminated water. The worms mature and reproduce in the blood vessels, liver, kidneys and intestines, releasing eggs which become trapped in tissues, triggering an immune response. This may manifest as either urinary or intestinal disease, resulting in decreased work or learning capacity. Mortality, while generally low, may occur in advanced cases, usually due to bladder cancer. Animal contact disease acquired through direct contact with local animals. Rabies. This is a viral disease of mammals, usually transmitted through the bite of an infected animal, most commonly dogs. The virus affects the central nervous system, causing brain alteration and death. Symptoms initially are non-specific fever and headache, progressing to neurological symptoms. Death occurs within days of the onset of symptoms. Prevention of infectious diseases.
Prevention is the key in stopping the spread of infectious diseases. It can play a major role between life and death. The basic hand-washing approach can play a major role in stopping the spread of the infectious diseases. Unfortunately, improper and infrequent hand-washing techniques are the major reasons for the spread of the diseases. The various ways of the prevention are:
hand washing.
At home or work, wash your hands at frequent intervals and properly. Use a warm water preferably.
Wet your hands before applying soap. Rub your soapy hands together for at least 10 seconds. Rinse your hands thoroughly to remove all soap. turn off the water with a paper towel. Dry your hands with an air dryer or a clean paper towel. Immunizations. Immunization is key to preventing disease among the general population. Vaccines benefit both the people who receive them and the vulnerable, unvaccinated people around them because the infection can no longer spread. In addition, immunizations reduce the number of deaths and disability from infections such as whooping cough and chickenpox.
Talking of tetanus and diphtheria, the kids receive vaccination at a very early age, whereas the adults should stay up to date with it. The adults who have never had chickenpox or measles in their childhood are more prone to the diseases, as they have never been vaccinated against the same disease. Childhood problems like mumps, chickenpox and measles are the main causes of infection amongst the adult.
Water pollution is the contamination of water bodies like lakes, rivers, oceans, and groundwater. Water pollution occurs when pollutants are discharged directly or indirectly into water bodies without adequate treatment to remove harmful compounds. Water pollution affects plants and organisms living in these bodies of water. In almost all cases, the effect is damaging not only to individual species and populations, but also to the natural biological communities. Waterborne diseases are caused by pathogenic microorganisms that most commonly are transmitted in contaminated fresh water. Infection commonly results during bathing, washing, drinking, in the preparation of food or the consumption of food thus infected.
The adverse effect of waterborne diarrheal diseases are found mainly in children of the developing countries. According to a report of the World Health Organization, the waterborne diseases account to 4.1% of the total global amount of diseases, and around 1.8 million people die annually due to it.
The term waterborne disease is reserved largely for infections that predominantly are transmitted through contact with or consumption of infected water. Trivially, many infections might be transmitted by microbes or parasites that accidentally, possibly as a result of exceptional circumstances, had got into water
We shall now talk about the diseases which are caused by protozoal infections. The first one is Amoebiasis. This disease is transmitted from hand to mouth. The microbial agent for this disease is protozoan, that is Entamoeba histolytica, which has a cyst-like appearance. The sources of agent of this disease in water supply are sewage, non-treated drinking water, and flies in water supply. The general symptoms of this disease are abdominal discomfort, fatigue, weight loss, diarrhea, bloating, and fever. The second disease is Cryptosporidiosis. This is also transmitted orally. The microbial agent for this disease again are protozoan, that is Cryptosporidium parvum. The sources of agent collect on water filters and membranes that cannot be disinfected, animal manure, seasonal runoff of water. The general symptoms are flu-like symptoms, watery diarrhea, loss of appetite, substantial loss of weight, bloating, increased gas and nausea. The third disease is known as Cyclosporiasis. The microbial agent for this disease is a protozoan parasite known as Cyclospora Taeniasis. The agents for this disease are carried through sewage and non-treated drinking water. The general symptoms are cramps, nausea, vomiting, muscle aches, fever and fatigue. The fourth disease is known as Giardiasis. It is transmitted through hand-to-mouth infection, and the microbial agent is protozoan known as Giardia lamblia. This is a most common intestinal parasite. The agents of this disease are untreated water, poor disinfection, pipe breaks, leaks, groundwater contamination, campgrounds where humans and wildlife use same source of water. Beavers and muskrats create ponds that act as reservoirs for Giardia. The general symptoms of this disease are diarrhea, abdominal discomfort, bloating and flatulence. The fifth is called Microsporidiosis. This is caused by a microbial agent which is protozoan phylum but closely related to fungi. The sources or agents of this disease are Encephalitis intestinalis, which has been detected in groundwater, and it is also in drinking water. The general symptoms are diarrhea and wasting in immunocompromised individuals. Waterborne diseases are caused by pathogenic microorganisms. Parasitic infections. The first one is known as Schistosomiasis. The microbial agent for this disease comes from members of the genus Schistosoma. The sources or agents of this disease are fresh water contaminated with certain types of snails that carry schistosomes. The general symptoms of this disease are rashes or itchy skin, fever, chills, cough and muscle aches. The second disease is known as Dracunculiasis or Guinea worm disease. The microbial agent for this disease is known as Dracunculus medinensis. The agents or sources of this disease are stagnant water containing larvae, generally in parasitized copepoda. The general symptoms of this disease are allergic reaction, urticaria rash, nausea, vomiting, diarrhea and asthmatic attack. The third disease is known as Taeniasis. The microbial agent for this disease are tapeworms of the genus Taenia. The sources of this disease are drinking water contaminated with eggs. The general symptoms are intestinal disturbances, neurologic manifestations, loss of weight, cysticercosis, etc. The fourth disease is known as Fasciolopsiasis. The microbial agent for this disease is called Fasciolopsis buski. The sources or agents of this disease are found in drinking water contaminated with encysted metacercaria. The general symptoms for this disease are diarrhea, liver enlargement, cholangitis, cholecystitis and obstructive jaundice. The fifth disease is known as Hymenolepiasis or Dwarf tapeworm infection. The microbial agent for this disease is known as Hymenolepis nana, and the sources or agents are found in drinking water contaminated with eggs. The general symptoms for this disease are abdominal pain, severe weight loss, itching around the anus, and nervous manifestation. Bacterial infections. Some of the important diseases caused by bacterial infections are botulism. This disease is caused by the microbial agent Clostridium botulinum. The sources or agents of this disease are bacteria which can enter an open wound from contaminated water sources. The bacteria can enter the gastrointestinal tract by consumption of contaminated drinking water or, more commonly, food. The general symptoms of this disease are dry mouth, blurred and or double vision, difficulty in swallowing, muscle weakness, difficulty in breathing, slurred speech, vomiting, and sometimes diarrhea. Death is also caused usually by respiratory failure. Another common disease caused by bacterial infection is cholera. This disease is spread by the microbial agent known as the bacterium Vibrio cholerae. The sources or agents are found in drinking water contaminated with the bacterium. The general symptoms of this disease in severe forms is known to be one of the most rapidly fatal illnesses known. The symptoms include very watery diarrhea, nausea, cramps, nosebleed, rapid pulse, vomiting, and hypovolemic shock, that is, in severe cases, at which point death can occur in 12 to 18 hours. Another disease under this category is known as E. coli infection. The microbial agent for this disease is found in certain strains of Escherichia coli, commonly known as E. coli. The agents are found in water contaminated with this bacteria. The general symptoms for this disease mostly is diarrhea. This disease can cause death in immunocompromised individuals, the very young, and the elderly due to dehydration from prolonged illness. One more type of infectious waterborne disease caused by bacteria is the very common dysentery. This disease is caused by a number of species in the genera Shigella and Salmonella, with the most common being Shigella dysentery. The sources are found in water contaminated with the bacterium, and the general symptoms are frequent passage of feces with blood or mucus or both, and in some cases vomiting of blood. Viral infections. Some of the common diseases under this category are.
Now we'll talk about the viral diseases. The very first disease, influenza. Influenza is caused by human influenza viruses. Though the strain of the viruses, it is said that it changes its variety every year, and hence no vaccine has been yet very successful against influenza. We know influenza is a very mild disease. It sometimes may turn into a hazardous thing or in an epidemic, but however it is quite mild to human beings. It raises the temperature by 99 degree Fahrenheit till 101 degree Fahrenheit. The person has sneezing, cold and cough, and this person suffers like having a upper respiratory infection, but actually it is not the infection, it is the viral, and usually viruses are self-limiting diseases, so most of the care and cure is not required, most of the medicines are not required. But if a person is very cautious about knowing that this is an airborne infection and air can induce any sort of infection into the body, the person will be very conscious about the air. Whenever there are ups and downs of the temperature, wherever we know that it is endemic in particular area, endemic means it is spread in a particular area and this particular area is getting many patients of the same disease. If we know that this is endemic in a particular area, in that condition people may wear masks, people may care for their own breathing, people may care for the droplet infections so that it is not spread through cough or sneeze of some infected person into a healthy person. So these are the preventive measures that the person should take. Most of the medicines are not required.
Adenovirus infection, which is caused by the microbial agent adenovirus. The agents of this disease manifest itself in improperly treated water, and the general symptoms include common cold symptoms, pneumonia, croup and bronchitis. Gastroenteritis. This disease is caused by microbial agents like astrovirus, calicivirus, enteric adenovirus and parvovirus. The agents manifest themselves in improperly treated water, and the symptoms include diarrhea, nausea, vomiting, fever, malaise and abdominal pain. Hepatitis A. This disease is caused by the microbial agent Hepatitis A virus, known as HAV. It can manifest itself in water as well as food. The symptoms are only acute, that is, no chronic stage to the virus, and include fatigue, fever, abdominal pain, nausea, diarrhea, weight loss, itching, jaundice, and depression. Poliomyelitis, commonly known as polio. This disease is caused by the microbial agent poliovirus, which enters water through the feces of infected individuals. 90 to 95% patients show no symptoms. 4 to 8% have minor symptoms comparatively, with delirium, headache, fever, and occasional seizures and spastic paralysis, and 1% have symptoms of non-paralytic aseptic meningitis. The rest have serious symptoms resulting in paralysis.
With the slogan of prevention is better than cure, we do understand that we should prevent rather than having the disease and then going to treat it. The waterborne diseases are preventable. If we have potable, safe drinking water, if we use the water which is at least safe for bathing, safe for cooking, safe for washing, and a safe water, a clean water, this naturally will prevent all the diseases that we think are waterborne. Let's start with our home. Within our home, if we have very good, a very clean water with which we are washing the hands, let us not wash our hands with soap and water even. But if the clean water washes the hands, it shall clean them. And this cleansing is highly required for preventing all the waterborne diseases at the first glance. Using the water in a hygienic manner in our home, having the clean utensils, handling the water cleanly, having all the reservoirs of the water, of the drinking water covered, having our bathing water separate, having our toilet water different, and having a particular understanding of the clean water, the cleanliness, this helps us prevent the waterborne diseases at our home. Coming to the community level, the first thing that we see is well. Wells usually are open wells in which filthy things are falling down into the water and this water is getting contaminated. We should have covered wells, first thing. Second thing, washing, bathing and such other activities near the wells should be avoided. Wherever we have bore wells, the underground water is getting used. Near the boring, we should never use the bathing and washing activity so that it contaminates the ground and the groundwater. When we speak about the lakes and ponds, it has got stagnant water. This stagnant water may also get contaminated, and since they are open, naturally contamination is known. If we allow the animals to go into the lakes and ponds, naturally the contamination level will be more. But if we prevent the animals from getting into the ponds and lakes, if we prevent human beings to go and wash and clean there, if we prevent any sort of effluent, any sort of sewage, sewage, any sort of filthy material to go and fall into the ponds and lakes, the ponds and lakes will be clean. They shall give fresh water, they shall give clean water which can be filtered and used naturally. But we know that only the filtered water won't do, because we have a population explosion seen even today in India. In this condition, what we should do is periodically get the water checked.